I am Dr. Rafi, consultant interventional pulmonologist from Care Hospitals, road number 1 and 10, Banjara Hills. Today we are trying to talk about the seasonal festival and then the seasonal change which is happening, like Diwali is around, and then also season of winter is hitting the doors here. So this season's festival, Diwali, is known for a lot of crackers, a lot of smoke, a lot of fun along with it for many years, where a lot of people would like to spend this festival in this manner. So of late, what we have seen is, with the increased in the city pollution atmosphere, and then also with these crackers, it will add more pollution and then more lung problems it is creating. So when I say lung problems, you know, like all the breathing is involved, taking the air in. If the air is not fresh, which is mixed with toxins, smoke, fog, and also along with this season's cold weather, all these things can put together, can cause havoc in the lungs and then cause breathing problems. So especially for the people like asthmatics and COPDs. COPDs means chronic obstructive pulmonary diseases. So these people are smokers usually. So smokers, they smoke, they breathe smoke, right? So in Diwali also, when you are enjoying and you are celebrating, you will breathe in the smoke of the crackers. So I think that is the reason actually even this can cause a similar problem. So we need to understand this in the Diwali time, this festival times, or more so when it is happening in the winter times. Lot of, and also in the city dwellers, or more so in even the upper towns, and now all are lot of family get-togethers which is happening after this. Almost the COVID has troubled for throughout the year most of the time. Now I think people are more mixing and then traveling, and then family get-togethers are happening. In this kind of scenario, this festival is coming. So I wanted to warn you, or just give you a guidance like how we need to go about it. When you look at it in this manner, so especially people who are asthmatics, COPDs, or who have flus, recovered from flus, colds, or any kind of pneumonia infections, these are all the people who have to be very careful when they are joining the festivities of the Diwali in this season of the winter, have to avoid the smoke. So altogether the advice is more towards do the festival. How we can avoid and then enjoy this festival? Let's look at it. I mean, more so this is a festival for the lights. So when you are lit up the home without having any smoke, so that means lights are welcome but not the smoke. That is how, if you want to enjoy this festival, then I think most of the problems of this season related to the smoke can be avoided. More so, when you look at the people who will be more vulnerable, are the ones who are tender, like young kids who have a tender lungs, little kids. They will be more prone for the smoke related problems, and then they can secondarily can cause them a respiratory distress. That means, when I say respiratory distress, means a breathing trouble, difficulty breathing that can happen to them, and then it can also damage the mucosa. That means the inner layer of the lung also can damage in the tender lungs, which is young kids, growing kids, and also who are vulnerable population, the other extreme. When you see the other extreme, all the elderly ones, elderly populations, grandmas, grandpas of the home are all vulnerable as well. So, and in between group who are already the sicknesses, if you can say elderly, obviously we know that they will be having some health issues or other, and also age is not on their side, and then they will be usually having diabetes, hypertension, and then the aging lungs. I mean, aging lung also would not respond to the smokes that well. So these are the age groups you need to be very careful when they are exposing in this winter months, and that too this very largely celebrated festival like Diwali. We cannot avoid the family gatherings, but following the norm of this year, like what I say, social distancing, clean hands, and face masks are not when you are enjoying in the family gathering, I would say, but at least a safe distance, and then not to having any smoky, any bothersome air, closed spaces you need to do in an open space gatherings for the families as well. So, and also when you see, and Diwali comes along with lot of sweet stuff. I mean, lot of sweets being shared, and then I would say for the families who want to enjoy this season with the Diwali and without having any lung issues, to be protective, to enjoy this with having a seasonal one checkup for the especially elderly who have the health issues, to come and then show and then have titrate their prescriptions. What I mean to say is titrate their prescriptions, how to take care about the continue their medication, and then who are on the asthmatics, on their inhalers, and then COPDs. Along with it, we give additional medications. Usually COPDs need additional protein energy malnutrition kind, like protein supplements also, especially for the elderly we are giving. Usually these are the things which has to be adjusted for the usually with every season for the lung problem. More so in this winter, people who have lung problems have to visit the clinician and then sort out their prescription, and then go about mingling with the family members with the precautions. What I mean to say, with precautions they can actually mingle with the families and then they enjoy the festivities. So, but the bottom line is avoid completely the crackers or smoke producing any kind of crackers or those kind of things, and then more moving towards more organic stuff like a simple lights or the simple old oil lit lamps are the ones which actually kept lots for the good lighting in the home. So I think this seasons I wanted to welcome the new winter season with post COVID, with the Diwali festival, with lot of festivities and lot of sweets, and then lot of lights and lot of cheers, and then the good health, but without any smoke, fog and any pollution. So welcome that, and then have a very good festival.